Very good morning here. My name is Tunde Osho from NEWS360. I'm the executive stroke managing editor. I'm in interview with Dr. Douglas Okor, a world-acclaimed neurosurgeon in Nigeria. He's going to talk to us about his background and profession. Very good morning to you, sir.
Thank you very much, Mr. Osho, and thank you to NEWS360 for having me.
All right. Now, let's begin this way. Now, beyond being a world-acclaimed neurosurgeon, who really is Dr. Douglas Okor?
So, my name is actually Douglas Emeka Okor. I'm actually from the southern part of Nigeria, from Delta State specifically. I'm not actually Igbo, even though my name is Emeka. My mom is from Asaba, but I'm actually Isoko. Okay, I actually did like my primary, secondary, and tertiary medical school in Benin. Did my NYC up north in Kaduna. Did a little bit of work in the University of Benin Teaching Hospital before I then left to the United Kingdom. So I actually trained to become a brain surgeon in the United Kingdom. And now I've been back in Nigeria for the last 10 years. Because one of the key things that actually made me decide to become a neurosurgeon was that when I was in medical school, we had very few neurosurgeons, in fact less than 14 then. So I actually felt that there was actually value to actually put forward for Nigeria. I actually promised myself that when I completed my training in neurosurgery in the UK, I was going to come back to Nigeria to try and push to actually sort of change the landscape of how we actually provide complex neurosurgical care, specifically what healthcare generally in Nigeria.
All right, doctor. Now, for the benefit of those ready for the first time, in simple terms, what does neurosurgeon do? Can you explain what brain GPS does and how it changed brain surgery out of here?
Okay, so basically, a neurosurgeon is a brain and spine surgeon. So neurosurgeons actually do surgery on people's brains and on their spine as well. Okay, so neurosurgeons basically actually manage patients, individuals, clients who have medical conditions that affect their brain, affect their spinal cord, affect their spine, and affect the nerves actually. The nerves are those wires that supply electricity to the body, isn't it? So you might be wondering, you said spine and spinal cord, what's the difference? So anybody who eats fish, for example, that bone, you see, is the spine, is a bone, okay? And then there's a soft thing in the middle, that's the spinal cord. So the spinal cord is actually the cable of wire that takes electricity from the brain to the rest of the body, and takes electricity from the rest of the body back to the brain, okay? And then the bone, the spine itself, protects the spinal cord. So basically, a neurosurgeon will actually be involved in making the diagnosis, treatment, which is
time. In a simple term, what does a neurosurgeon do? Can you explain what brain GPS does and how it changed brain surgery out of in Nigeria?
So, Mr. Osho, a neurosurgeon is a brain and spine surgeon. So a neurosurgeon actually operates on the brain and the spine. So basically what a neurosurgeon does is that they get involved in the prevention, the diagnosis, the treatment, which is usually surgery, and the rehabilitation of patients who have medical conditions that affect their brain, the spine, the spinal cord, and the nerves. So I'm sure you heard me say spine and spinal cord, and you wonder, oh, what's the difference? So if you eat fish, that bone in the fish is actually the spine, and there's a soft thing you pull from the middle, that's the spinal cord. The spinal cord is that part of what we call the central nervous system that actually takes all the electrical activity from the brain to the rest of the body, and also takes information from the rest of the body back to the brain. So basically that's what the neurosurgeon does. When we come to talk about a GPS system, the new GPS system is actually called a neuro navigation system. So it's all about precision and accuracy. So for example, if you have an abnormality, a lump or whatever in the brain, in a particular area, stuff like that, you can do a brain scan, put it onto that new navigation system, this GPS system that you talk about, okay? And you can actually map that using infrared and stuff, and actually pinpoint looking on the screen. And when you touch a particular area of the brain, it shows you that, oh, that's exactly what the tumor is. So it actually helps with precision and with accuracy in brain surgery. And yes, absolutely. This technology has actually radically changed in terms of when you look at the efficiency and effectiveness and the safety of doing this surgery. It actually really helps. Now here in Student Medical School, we don't have that. Okay. I think very few people, I think I only know one facility that has that in Nigeria. But here we dig back to the old school, making sure that we know anatomy and stuff like that. And touch wood, even without such very big technology and stuff, we are providing absolutely fantastic outcomes for Nigerians.
Okay, doctor. Now, in your practice, what are the most common neurological conditions you have seen in Nigeria today? And we are seeing an increase in cases of stroke, epilepsy, or memory loss.
Okay. So basically, the most common neurological, neurosurgical conditions that you will see is actually head injuries from trauma. Okay. And now the key thing, yes, we are in Citadel Medicals here, where we actually do this procedure. I'm sorry, doing this. You see, I'm a surgeon. I'm thinking about procedure. So we're actually doing this very nice interview to actually inform Nigerians. But I'm actually not only based here. I'm based in the Federal Medical Center, Abuja, which is a public tertiary hospital in Abuja here, and also collaborate with other individuals. For example, the hospital like Nizami. Okay. So for me, it's about actually doing my best individually and working with different teams to actually provide this care. So trauma, for example, especially in places like Federal Medical Center, is one of the most common, where you actually have head injuries, and the most common was actually road traffic accidents. Okay. Now, apart from trauma, you have other things like brain tumors. Okay, nasty brain tumors. So you have tumors that might not be cancers, and the ones that are nasty that are actually cancers. Okay, infections. You can have actually infections affecting the brain. Have someone having what we call a brain abscess or pus in the brain and stuff like that. Okay, you can also have degenerative wear and tear problems with the brain. For example, who have actually dementia and actually have shrinking of the brain, and then you might have some sort of accumulation of fluid in the brain, what we call normal pressure hydrocephalus. Okay, then you actually have what we call neurovascular problems. You have people, for example, even the stroke is a type of neurovascular problem, so I can just call it strokes.
Okay.
You can have strokes where the blood vessel that's supplying a particular part of the brain gets blocked. Okay. You can also have strokes where the blood vessel supplying a particular part of the brain actually ruptures and bleeds. Okay. One of the very nasty, sinister medical conditions is called the subarachnoid hemorrhage. Subarachnoid hemorrhage from a brain aneurysm. A brain aneurysm is like a bubble or like a weak spot on a blood vessel, and it can rupture, okay, and then they bleed. About half of patients who have had that sort of bleed actually die on the spot because it's a nasty disease. Now, for me, even though I'm a neurosurgeon generally, I'm actually sub-specialized as a neurovascular surgeon. I do what we call skull-based surgery as well, okay? And I do, like, using the telescope through the nose to actually operate on tumors at the base of the nose. And of course, I do complex spine surgery as well. So one of the other things that we do is actually complex spine surgery, okay? So those are some of the common ones we actually have in Nigeria. But there are other types of surgeries, but which we don't have the sort of level of technology and expertise in Nigeria. We call that functional neurosurgery. So you can have people who have very weird areas in their brain that makes them have seizures or convulsions, okay, and then you have to do what we call epilepsy surgery. Okay. You can have people who have movement disorders, things like Parkinson's, things like essential tremors and stuff like that. And you actually have to put probes, what we call a deep brain stimulator, in the head and stuff to actually try and change the signal in the brain to try and reduce some of the symptoms that people have. Like, we don't do that in Nigeria, but clearly because I'm trained in the UK, I was involved with that when I was in the UK.
Okay, you mentioned something like epilepsy and dementia. There's still a lot of stigma and myth around conditions like epilepsy. Some attribute them to spiritual causes. How do you address this as a medical expert? And what should the public know?
I think the basic thing is that the brain is like a generator. Okay, the brain provides provides electricity. Okay, and that all that electricity actually flows to the body. That the nerves that actually take all this electricity from the brain to the rest of the body, they are like cables of wire taking electricity. Okay, so one key thing is that anything that irritates the brain will cause that electricity to be very excitable, and maybe too much electricity that's not able to be controlled. Okay, so anything that will cause the brain and overexcite it, make it to produce too much electricity like that, okay, will cause seizures. Okay, what we call it locally, people understand as convulsions. Okay, so but a couple of things can actually irritate the brain. You can have some abnormalities in the brain that are not very obvious. You do a scan, the average radiologist will not pick it up. The scan looks normal. Why is this person having seizures? You can have what we call temporal lobe sclerosis. Sorry?
You can have what?
You can have a situation where you have an abnormality in a part of the brain, but the brain scan that's being looked at by a general radiologist. A radiologist is an X-ray doctor who looks at scans and stuff like that. You might not pick it up because in Nigeria, for example, you don't have specialists. You usually don't have subspecialists who are radiologists, who are X-ray doctors who actually look at those scans. So usually they might not pick it up. You might have a particular area of the brain where there's an abnormality. For example, a part of the brain called the medial temporal lobe. Okay, that can cause what we call complex partial seizures. Okay, I'm just giving you examples. Also tumors, different tumors in the brain and stuff that can irritate the brain and cause seizures. You can have infection in the brain, also causing seizures. A bleed, all these strokes we talk about, a bleed into a part of the brain and stuff can also cause seizures. So the simple thing is that anything that can irritate the brain can actually cause seizures. Okay? In young children, children below 5 or so, they might have malaria, have very high fever. The high fever itself, they also can irritate the brain, and they will have what we call under 5 seizures. Okay, or what we call febrile seizures. Febrile seizures. Okay, but the key thing is that it is that's a word I'm looking at. It is not spiritual attack. It is not arrow from the village or anything like that. It's just a situation where anybody who has seizures, has epilepsy, there's something irritating the brain. The origin is actually from the brain because there's something actually irritating it. Was there another question with that? Seizures. Dementia. Okay, so dementia. How do you
address this, and what should the public know?
So basically, that's the case in the public should know. The public should know that, oh, this is not a spiritual attack. It's not an issue of, oh, somebody in the village is against you or something like that. It's just that you have a medical condition, something that's affecting your brain. I've given some examples of what those things could be. So what should they know? If someone is having seizures, maybe for the first time and stuff like that, and they're worried and stuff, one of the key things I always say is that, please, they should be going to a facility that has the capacity. Okay? There are different levels of care. There's primary level care, secondary level care, and tertiary level care. My strong advice to Nigerians is that whenever you have not just seizures, now with seizures, convulsions, epilepsy, you're worried and stuff, please go to a tertiary facility. Okay? And I'll give examples of 3 in Abuja. So National Hospital Abuja, okay, Federal Medical Center Abuja, and then the Abuja University Hospital in Babylada. Those are public tertiary hospitals. So when you have any sort of brain attack, brain problem and stuff, that is where you should be going. Because one of our ideas as Neurosurgery is that time is brain. Okay? Anybody who has even head injuries, anything that's affecting the brain, that you feel that, oh, this is an emergency, this is worry, please do not go to your next private hospital next to your house. You are wasting time. If you waste too much time, you can get to a point where whatever has affected the brain cannot be reversed. So please, the phrase is facility with capacity. Very, very important.
You mentioned public hospital, and there are private hospitals or clinics like yours that have expertise. Now, do the public hospital have that kind of expertise?
So that's the paradox. It's a paradox. Okay. So let me explain that paradox, and it's very, very important that Nigerians know. So most public hospitals have almost all or most of the specialists that you need. So in the public tertiary hospital, you have the anesthetists there, you have the endocrinologist, you have the cardiologist, you have everybody there, okay? But so that's the positive in the public hospital. But the drawback is that usually they won't have the equipment. They won't have the required equipment, technology and stuff like that. They might have their expertise, but they won't have the equipment, the technology and stuff like that. Now, conversely, the private hospital might have the equipment. You can see what's behind us, the equipment, okay? They might have the equipment, they have this and that, have the technology and stuff like that, but they won't have the staff, okay? So you have to pull staff from outside and stuff. So for example, in these digital medicals, for example, okay, now and again we look after patients who are like emergencies and stuff like that, but we tend not to do that all the time. We actually choose cases. Okay, so a significant number of cases that we do here, for example, are more elective cases. Elective means they are planned cases. Okay, but in the tertiary hospital, yes, because they have the capacity of the staff, everybody there. Okay, they have very good emergencies. They have lots of emergencies that come through and stuff like that. That I would strongly advise that somebody goes there. Okay, because once we get there, the staff they are there 24/7. If someone with an emergency comes here, for example, it will have to be planned. And planning for an emergency is a little bit tricky, isn't it? So usually my strong advice is that, if you have an emergency, first dock at a public tertiary hospital, okay? Or there are some private hospitals that probably have the capacity, but the average Nigerian public will not be able to afford them, okay? So places like Nizami, for example, places like maybe Cedar Crest, okay? But yes, but here, for example, if you go on YouTube, because one of the key things I started doing when I came back to Nigeria was start pushing about the capacity that we can actually provide complex neurosurgical or complex tertiary care in Nigeria, okay? And so if you go on my YouTube channel, for example, just using my name, okay, you'll be able to watch lots of videos of very complex brain surgeons, but the kind of stuff people never ever thought that we could do in Nigeria with absolutely fantastic outcomes, okay? And they were done here, okay? But these were not emergencies, they were planned cases.
Okay, my next question is, do you collaborate with public hospital and do you have referrals from them?
So generally, there's in Nigeria, we have very weird protocols and policies. Okay, somehow most of the public tertiary hospitals in Nigeria, they frown. I think it's a policy for them to actually refer a patient to a private hospital. Okay, so they actually frown on that. But collaboration, yes. So because I am actually based in Federal Medical Center and
National Hospital.
Yeah, not just a Federal Medical Center, and here. I sort of ran sort of unofficial collaboration at some point. So at some point, for example, in Federal Medical Center, they did not have that thing at the back there, what we call an operating microscope, okay? All the complex of doing complex brain surgeries, doing the brain aneurysm stuff I talked about, where we clip aneurysms and stuff like that, okay? I couldn't do them in Federal Medical Center, okay? So usually when the patient docks there and has that kind of problem, I have discussions with them and stuff. We actually transfer the patient here, do the operation, stabilize the patient, and actually transfer the patient back, okay? Because the ICU in Federal Medical Center, for example, is actually not that bad, but they didn't have an operating microscope there. But luckily now, they do have an operating microscope in Federal Medical Center, so most of these patients are actually able to look at that there. So but then there was this unofficial collaboration. Now, in terms of looking into the future, is that something that I would want as a policy? Yes, sir, definitely, we really do need that to actually facilitate things.
Okay, now, without breaching any patient's confidentiality, is there a particular case using stealth guided surgery that captures why this technology matters in Nigeria?
Okay, so let me put it this way. Okay, I'm a believer in making sure that you actually sort out foundational stuff before you fly to the moon. Okay, in Nigeria we are struggling with basic foundational stuff. Okay, in Nigeria, in the whole of Nigeria, I think there are probably about one, maybe tops, maybe two places that actually have that facility, the stealth we talk about. So the stealth, so the real one is a neural navigation system. Stealth is just one of the companies that does it. So there's Brain Lab, there's Stealth. Okay, there are two different companies. I'm sure there's even another company, but it's called a neural navigation system, or a local it's called a GPS system. So, like I've said before, okay, if you have that kind of working system, it definitely facilitates your things in terms of safety, in terms of precision, in terms of accuracy and stuff. Okay, but in Nigeria, with 140 million multidimensionally poor people, instead of me getting someone to actually buy such a machine and stuff that is going to go into that kind of machine, I'm sure it will be up to maybe like $250,000 to maybe $500,000 and stuff like that. That money can go even basic equipment you are struggling with. Okay, so granted, if somebody can actually get such a machine, okay, most probably that machine will be where? It will probably be in a private hospital where the average Nigerian will not be able to access it. Okay, so generally we will again, machine, very, very important, okay? But realistically, in Nigeria, because I'm a very pragmatic person, okay? Mr. Osho, I'm very pragmatic, okay? So realistically, in Nigeria, for a good number of the patients that we actually look after and stuff like that, we won't be able to actually use that sort of stealth, GPS, brain lab, neural navigation system for the average Nigerian patient. So it is the bourgeois, and the big people, and it's those ones who don't fly to France or Germany or Dubai to actually get care. Okay, maybe those ones who can actually manage to actually do the work. Like I said, it's still here, we don't have that. A significant number of facilities in Nigeria don't have that. Only one or two. If we did have stealth, so yes, it would help. But guess what? That is why I'm a brain surgeon, and I started to be a brain surgeon, so I know all parts of the brain and stuff. I can look at scans, I can calculate stuff, and so far, touch wood, Mr. Osho, because whenever I need precision and accuracy to actually get to a place in the brain and stuff, like, we are still doing very well, using old school just knowledge of anatomy of the brain and of the head.
You know, I got confused at some point. You are a neurosurgeon,
yes,
and we have neurologists.
Yes.
Now, can you just give us the difference between these two professions?
So there are a couple of specialists who actually deal with anything to do with the brain, what we call organic or functional. So I'll give an example. So we have the psychiatrist, for example, who is like a mental health physician. So who have mental health problems, we call them functional brain problems. Okay. Then you have the neurologist that you talked about, and then you have the neurosurgeon. Okay. So psychiatrist, like I said, mental health issues. Okay. The neurologist is a specialist who looks after patients that have medical conditions that affect their brain, their spinal cord, and the nerves. But they don't do operations. They don't do surgical procedures. Okay, so they look after patients. For example, most patients that will have seizures and epilepsy, for example, the neurologist will look after them. So the neurologists are very good with medication, with drugs. They know how to prescribe drugs very well, follow up with the drugs and stuff. You know how to do very big investigations to find out what's happening with the brain. I usually jokingly say they are more intelligent than us brain surgeons. So because they can look into the depth of things and stuff like that. Okay. Now the difference between a neurologist and a neurosurgeon is that while a neurosurgeon does the same thing in terms of looking after patients that have problems that come from their brain, the spinal cord, the spine and nerves, we actually do operations. So we actually operate on the brain, we operate on the spine, the spinal cord, and the nerves as well.
Okay, another point is you are a surgeon.
Yes.
Working on the brain. Now you use technology.
Yes. Well, that thing behind you there is technology. Yeah. This one here is technology. So that's an operating microscope, and this is a fluoroscope or a CM. So we usually use this for spine surgeries to actually do like X-rays, intract, actually make sure that we're in the right place in the spine and stuff.
Okay. My question is, using this technology to operate faster, how long does it take a patient to recover from the surgery?
So again, it just depends on what kind of surgery you're doing. Okay, you can class surgeries into something minor, something in terms of major, okay, and maybe somewhere in between. Okay, so usually for simple surgery, I'll give an example of simple surgery. So for example, you can have a liquefied blood clot, okay, just around the brain, what we call a chronic structural hematoma. Okay, and with that one, you just do a hole in the skull, 2 holes in the skull, and let it out. That's very simple. Usually, 45 minutes, an hour, you finish with surgery. Okay. Yeah, you use some sort of technology there, but not massive technology and stuff. Those kind of patients, almost immediately, they are waking up. Maybe within the next 3 days or so, you're sending them home. Okay.
The next 3 days.
You're sending them home. Okay. So, if everything goes for the next 3 days to 5 days, you're sending them home. Okay. But if you're not doing something more complex, like a complex brain tumor, for example, okay, the planning is very expensive. You need to use big equipment and stuff with the operating microscope, for example. And usually those kind of patients will be looked. So the first one I talked about, the minor one, you can send them to an ordinary ward, what we call level 1 care. Where you can just have them on the ward, maybe one nurse looking after 3 patients or something like that. Okay. But when you do complex brain surgery, the patient has to be looked after the surgery in critical care, what we call the intensive care unit in an ICU, with ICU nurses, the anesthetists being involved, and the whole bigger team being involved.
So after that surgery, how long does it take?
So it just depends. Okay. So usually, if such surgeries go well, touch wood, luckily here, a significant number of surgeries actually go well. So on an average, you're going to have patients staying in the ICU for an average of maybe like 3 to 5 days, just depending on the surgery. But from there, they now step them down from the ICU to a level 1 ward, okay, and they might spend maybe like 1 more week or something like that.
Okay, sir. Nigeria has a limited neurosurgeons for over 200 million people. What are the biggest challenges facing neurosurgical care in our hospital, and what needs to change?
So basically, Mr. Osho, like I said, I decided to become a neurosurgeon somewhere in 1999, 2000, when I was in my penultimate year in medical school. Then there were not more than 15 neurosurgeons then. Yes. Presently, there are actually more than 200 neurosurgeons in Nigeria now. Okay. So the number was significantly improved. Okay.
1 per 1 million.
Well, so overall, the numbers have improved. It's still not enough. Yeah. Still not nowhere near enough. But what I'm saying, that number has significantly increased. Okay. But if you now look at it per population, I'm sure we are up to about 230 million now, even though we've not conducted the census in the US. Okay. So it's still not enough. But what I'm saying is the numbers are definitely more compared to previously. So what are the key issues? Even the training. Even the training of neurosurgeons, you can't compare the training of neurosurgeons in Nigeria to many places like UK, US, other developed economies, because there they are very well trained because they have all the gadgets and everything to actually train them. For example, this operating microscope behind it, a significant number of Nigerian neurosurgeons who are trained here were not trained to actually use technology like this, so it's a little bit of a struggle. So when it comes to the very complicated, delicate operations in the brain and stuff, they struggle a little bit with the competence and the capacity to do it. Input determines output. Okay, so that's one of the key things. Nigeria, we have not invested resources in healthcare generally, talk less of a specific subset of healthcare like neurosurgery. So again, remember I said different levels of care, primary, secondary, and tertiary. Neurosurgery and cardiothoracic are quaternary care, level higher.
Neurosurgery, repeat again.
Neurosurgery and cardiothoracic surgery, so operating on the heart.
Cardiothoracic.
So yeah, cardiothoracic surgery. So yeah, I describe them as quaternary, they're even bigger than tertiary surgery. Okay, so the investments in terms of workforce, in terms of gadgets, in terms of consumables, in terms of what you need in terms of technology, equipment, and stuff like that, has not been great. In healthcare across the whether primary school, we've not invested in it. So again, the output that you're actually going to get in terms of the services that you get are not going to be great. Because we're talking comparatively in our cities. Okay, so those are some of the struggles that we have, just that lack of investment, issues with workforce planning, technology issues, equipment, and stuff like that. So those are just some of the issues that we have.
What you just described is very scary.
Yeah, it is. Absolutely, it is.
Okay, many Nigerians still travel abroad for brain and spine procedures. What will it take for us to reverse this trend, and what role can centers like Citadel play?
So guess what? It's happening already, Mr. Osho. It's happening. In the last 10 to 15 years, I call it the real private sector. So the real private sector has done an absolutely fantastic job, a yeoman's job, in terms of pushing the boundaries of providing complex care. Okay, and I'm talking about that sort of advanced care that most of us go outside Nigeria for. So people don't go outside Nigeria because they have malaria and typhoid and tuberculosis and HIV. That's not why they
well, some do. Some do.
Yeah, so generally,
I know somebody that buys all his paracetamol from UK. If we use the one you want to use for the whole year.
So we call it London paracetamol. So, but anyway, so they've done a human job in terms of providing the availability, Mr. Osho, of complex care. I'm very specific with that word. Availability. Okay, so now since this government came in the last 3 years, the present government came in the last 3 years. Okay, it's been a struggle with in terms of the economy and stuff like that. Okay, so a good number of maybe middle class people that would go to India before and stuff like that, because of the dollar rate now, is a struggle. So you now find out that that good job that the private sector has done in these 10-15 years is now helping those people that cannot go to India.
I'm paying off to you.
so you now have a good number of people actually staying back and actually getting this care. But it is still a struggle. Okay, we are still struggling. When it comes to the issue of affordability and accessibility, a significant number of Nigerians will not be able to afford this kind of care. Okay, so that's why you see, if you look at the numbers, the sheer numbers of cases that are being done in Nigeria, brain surgery, spine surgery, and stuff like that, you cannot compare it. For example, Nigeria's population is about 230 million, isn't it? UK's population is about 67 million. Okay, so our population is what? Almost three times the population. Yeah, but if you look at the number of neurosurgical cases being done in UK, definitely more than Nigeria. And it's not because we don't have neurosurgical cases in Nigeria, because many people in their village who have the problem and they just die and stuff, and they say, oh, God has done it and stuff. So those are some of the big struggles that actually happen in this part of the world.
No, away from these technological operations, let's talk prevention. What are 3 or 4 practical daily habits you will recommend for every Nigerian to keep their brain healthy, especially after age 40?
Mr. Shaw, these are excellent and very, very important questions, and I'll tell you why. Okay, in a country as poor as Nigeria, a low-income country, where you have 140 million multidimensionally poor people, okay, you want a situation where you can strengthen preventive and promotive care. Why? Because a significant number of people, if they run through trouble with some of the things I talked about earlier, these brain attacks and stuff, okay, they won't have the resources to actually be going into a hospital, getting ICU care, which is going to millions. Okay, so the first thing is prevention. And you're right about that age, 40 years. Okay, but on the age of 40, that's when people who I strongly advise start looking after yourself. So there are a couple of things. Okay, there are a couple of medical conditions that can predispose, or there are risk factors to developing brain attacks and stuff like that. Okay, and a couple of them include things like high blood pressure. Okay, the number of Nigerians, if we were to actually do a survey and actually really assess the number, a significant number, I'm talking of adults now, adult Nigerians are actually hypertensive. They have blood pressure issues. and that's one of the major risk factors. Okay, other modifiable risk factors are things like alcohol intake and cigarette smoking. Cigarette smoking and by extension high blood pressure are two of the key risk factors that can actually lead someone to develop brain aneurysms. Remember brain aneurysms I talked about earlier on? Where I say once it ruptures, about a third of people die on the spot. Okay, so usually my friends who smoke, I usually joke to them and say, hey, very soon I'll be clipping your aneurysm. I'll be doing a surgery to clip your aneurysm because of this smoking. Okay, and of course things like diabetes, being overweight. Okay, these are some of the things that we frown on. So what do you do? Okay, so the key thing is that you live a healthy life. Okay, so your diet. Okay, so your diet, especially when you get to like 35, 40, so your diet should be significantly reduce your carbohydrates. Okay, increase your vegetables, increase drinking water is very good, keeping very well hydrated. Fruits, okay, and proteins. Okay, but significantly reduce your carbohydrates, significantly reduce the amount of food that you eat. Sometimes you go to parties and it's buffet or whatever, so you see Nigerians, you just see the amount of food they put in their plates and you just scratch your head, isn't it? So diet is extremely important, okay? Exercises, okay? You don't need to be jumping mountains and running up and down, so even just like doing walks every day, 30-minute walks every day and stuff like that can actually help, okay? Don't do sedentary lifestyle. Some people they leave their house, AC into their car, AC into the office, back and stuff like sleep, and that's dangerous. Watching your weight, extremely important. Okay. Stress is a major factor that can push people to actually have things like high blood pressure. Okay. So yes, I know everybody wants to make money and stuff like that, but people should actually take time out for leisure, time to rest, time to actually take holidays and stuff. If you have the money to take holidays. Okay, so those are just some of the common sense things in terms of prevention and promotion. But specifically, once you get to the age of 40, you should not become a friend to and get married to your family doctor. Okay, so that means that when almost at least between 6 monthly to yearly, you go into the hospital, they do some blood tests for you to check your kidney function, your liver function, check your blood level and stuff, check your blood pressure. In fact, everybody over 40 should have their own blood pressure monitor at home. If you can buy it, usually most of the big pharmacies actually sell it. And actually monitor your own blood pressure. Okay? And so you do that, because you can pick up things very fast. So for example, I just picked up recently because I always do it. Because I just came up, I just picked up that I'm almost getting to the point where I become diabetic. Okay, I'm not diabetic yet, but I'm almost getting to that point. So I already know because I've been following up and stuff. So now I'm already changing things now and stuff like okay, now I have to start changing my diet, I have to start doing this and stuff like that. So that is why it's preventive, isn't it? So you actually have to find it on time. Okay, so if you do those regular medical checks, the chance of you picking something on time and actually start dealing with it and preventing stuff and actually prevent you from getting to the point where you actually have a bleed in the brain, have a stroke, and have all these other things that will not run into trouble. So the key thing is prevention and sort of health promotion.
Complex. I say complex because majority of the real cause of hypertension, BP, diabetes, and stuff like that are from food.
Well, so food plays a major role. How people eat, their diet, it definitely plays a major role. And plus other things as well.
And the root cause is sugar.
Yeah, so sugar. I like sugar a lot, but recently I've severely cut down my sugar. God, I've severely cut down my sugar. So yeah, so that's what I'm saying. That diet thing, in terms of your diet, so once you get to that age of 30, 35, 40, is extremely important.
All right, let's move faster because of time. Now, with technology, social media, and long hours on phone and laptops, are we seeing a new neurological concern in young people? How concerned should parents be?
Okay, so basically, there are two things there that I will actually pick up. I can talk about some disadvantages from the point of view of looking at neurological stuff or mental health stuff, okay? Neurological and mental health stuff, and some of the advantages in terms of information, okay? So from the mental health stuff, okay, the fact that you actually have young people who are always on their phone and stuff, like maybe everything that's happening around them, for example, in Nigeria today, we are being hit on all sides by different things and stuff, so that can actually affect mental health negatively. Okay, so my advice usually regarding that is that, okay, please just know how you actually consume information on the social media and those platforms. Okay, and actually sort of set some boundaries. So for example, you can say, okay, I'm going to have a particular time from this time to this time. When I get home by 4 to 6 p.m. or something, I can consume Nigerian news. Okay. After 6 p.m. or 7 p.m., I'm not consuming Nigerian news. Okay. The only things I'm going to do are things that edify, or things that will inspire me and stuff like that. So that's my strong advice. Then the other thing, from the point of view of the neurological health and stuff like that, the spine specifically, okay? When people are actually using their phones, it's not to actually use your phone like that, if you can, okay? And to actually keep bending them, because that stresses what we call the cervical spine, or the spine in the neck, and that can actually hasten or sort of make the wear and tear in the neck, the spine in the neck actually progress one step.
Okay, it's straight like that.
So even at work, for example, the people who use desktops and stuff like that. So sitting and looking at your desktop and typing is much better than actually your desktop down there and your. So I'm just talking about the amount of stress on the muscles and stuff around the spine and the neck, and the fact that can actually make the wear and tear, because all of us are going to develop wear and tear at some point just with age. So but that can make it faster. And so those are the two things in terms of neurological, in terms of the spine, and the mental health in terms of what especially young people are consuming on social media. From the point of view of the advantage in terms of information, okay, we have information on our palms now. Once you hold this phone, so you have information there. Okay, so it's very easy. So even some of the questions you're asking me now, for those people who are supposed to be educated, you can just go on AI, for example, ChatGPT or whatever, so ask them good questions. So they actually give you some good answers, and you can always double check those answers with a specialist or with someone who is a specialist, basically.
All right.
Okay.
Now, my last question is this. Medical technology in neurology is advancing fast globally, from MRI to new treatment options. How accessible are these modern diagnostic and treatments in Nigeria?
Okay, generally, I've talked about some answer this already, but I'll state it again so we can actually really put it in there. Technology over the last 10, 15 years in Nigeria in terms of providing neurosurgical care has significantly improved. Okay, but comparatively, when you look at the developed economies, we are nowhere near them. Okay, and even the improvement we talk about in Nigeria ends in a soft set of places. Okay, so for example, when you look in Nigeria, we look at places like Lagos, Abuja, maybe Port Harcourt, maybe Kano, maybe Owerri and stuff like that. They are not widespread. Okay, in terms of these technologies and this capacity and stuff, they are not actually widespread. So a significant number of Nigerians, from the combination of the fact that it's not widespread and it's not evenly distributed, plus the fact that a significant number of Nigerians, at least up to 65% of them, are extremely poor. They're both struggling to eat. Talk less of saying we're having a neurological problem and going somewhere to go and access MRI or whatever stuff like that. Abuja, for example, has almost like 10 places where you can actually access MRIs, top class MRIs and stuff. So in Abuja, for example, we are really served very well when it comes to most of these technologies of where you can actually investigate and make diagnosis of brain and spine problems and stuff. So we are sort of lucky in terms of the fact that we actually have the availability. But again, I still go back to the issue. Is it accessible? Is it affordable for the average Nigerian? A big struggle, unfortunately.
Well, finally, what is one message you wish every Nigerian family reading Prime News 360 today with you will take home about protecting their brain and nervous system health?
So specifically with protecting their brain and stuff is that number one, okay, if you develop a brain problem that is preventable, because there are some that might not be preventable. For example, people who develop brain tumors and stuff that usually we don't know what causes them. Okay?
Well, we don't know what causes brain tumor.
No. Generally, we don't. Okay. So there are lots of millions of pounds and dollars have gone into research and stuff to actually find what's the exact cause of this, and it's a big struggle. Okay. They might pinpoint a couple of things that might be risk factors or some things that might contribute and stuff like that. But on an average, it's difficult to say, this is what's causing the brain tumor, or this is what's causing the brain tumor. Okay. So, but in the other kind of things, for example, the strokes and stuff, infection and stuff like that, we know what actually causes them, the main risk factors and stuff. So for those that are preventable, and funny enough, those are the ones that are bigger in number. the preventable ones, the head injuries from road traffic accidents and stuff like that, the bleeds, the strokes and stuff, those ones are the ones that they are actually more in number. I mean, if you look at the statistics, more people have those problems when it comes to brain attacks and brain problems. So the key thing is prevention is better than cure. Prevention of those things. Okay, so we talked about the issue of making sure that when you get to a particular age, you start behaving a particular way. Okay, and of course, I talked about the issue of even if somebody develops those problems. Okay, make sure you know where you're going to. Do not go to your next private hospital that's next to you. Okay, because that private hospital or herbalist. Okay, because that private hospital, yes, they want to make their own money as well. They will take and put drink for you and stuff like that. But time is going. Okay, there's what we call the golden hour. Okay, that's one of the things that I feel that people don't tell our politicians. They keep amassing all this wealth and stuff, but they don't know that when they run into trouble with any of this problem, because lots of our politicians have these problems, the diabetes, the hypertension and stuff, a good number of them are predisposed to actually having stroke. So if within that golden hour they cannot fly to South Africa or Germany or whatever, so they will die if they don't have the capacity in Nigeria to actually provide that sort of care for them. Even the politicians.
That's the message.
Yeah, message to politicians. Take healthcare seriously and take all these kind of things that we've talked about so far seriously. So to Nigerians generally, it's about prevention. Make sure you're living a healthy lifestyle within your means. Be very, very careful. When you get to the age of 35, 40 and stuff, start doing everything to prevent everything, do everything in moderation. Okay? If you're the one that likes alcohol, in moderation. Eating. You get a plate of food and pack fufu, 3 fufu inside and stuff. Be very, very careful about it. So that's just general, because again, it is much more cheaper to prevent these things, because when they happen, you're also getting into an ICU, you're spending millions, which the average person actually doesn't have.
You're talking about prevention and being looking after some cheap something so that they will not come for great surgery. So how would that be with you?
Well, so I'm being realistic here. Okay. So there are some people, no matter what you do, you will have people coming through that need help. Okay, but if we can reduce those numbers, because especially in a place like Nigeria, they are not even coming. Yeah, they don't even have the resources to even come in the first place. You understand? So I'm saying that, okay, especially for those that won't have the resources, prevent it from happening in the first place. That's why one of the things I really push for, okay, is that we actually strengthen our primary healthcare system, which is almost non-existent. Okay. The other thing, people keep saying that, oh, now I'm a politician. The other thing is that we need to look at how, because the key issue of governance, one of the focus of governance is actually healthcare, isn't it? And for a very long time in Nigeria, we've not had governments that focus on healthcare. So one of the key things I keep asking everyone is, have you gotten your PVC? Yes, get your PVC. Some people say, oh, politics, you know, like, no, but politics likes you. Because whatever the politicians are going to do, whatever they're going to focus on is going to affect your life. So that's one thing I'll actually tell people that, oh, please be interested in politics. Get your PVC. Look at all the councillors, local government chairmen, state house of assembly people, your house of rep, senators, governors, and up to the president, and say, oh, look at their background and stuff like that. What does this person think? Just like, what does this background tell you in terms of what they think about development? You know, in this part of the world, sorry, I just have to say this. In this part of the world, even the professional class think that development means big roads, bridges, flyovers, and stuff like that. No, that's not what development means. Development means bringing an acceptable standard of living to a significant number of your population. That's what it means. So, for example, I'll give an example in Abuja. Okay, you see roads being constructed everywhere in the town and stuff like that. Now, imagine, for example, that they said, "Oh, we don't have that much money in Nigeria at this particular point in time. Leave all those roads, those flyovers, and stuff like that. Let's focus on the primary schools." Okay, the secondary schools. Let's focus on the primary healthcare centers. Let's focus on the roads that are going to the interlands and stuff like that with that money and stuff. You will actually impact in more people's lives, and that's what development actually means.
All right, let me give you a bonus question.
Yes.
Now, Dr. Okor, where can people reach you or access reliable neurological care, and what final word of advice do you have for our readers?
So basically, like I said, I provide private care here. It's International Medicals. I'm also one of the 3 consultant neurosurgeons in the Federal Medical Center, Abuja. It's just next to the EFCC building. I usually get angry that when I look at the EFCC building, is much more beautiful than the hospital. So it tells you the priorities of how people actually do when EFC is much finer. And of course, I like I said, I support other of my colleagues. For example, my colleagues in Nigerian, whenever they have very complex brain surgery cases, I actually help support them. So maybe Citadel Medicals and of course Federal Medical Center. Basically, one of the things that I've tried to do in the last 10 years that I've been back on the ground in Nigeria is to actually build up teams. Just it's like an orchestra, isn't it? Where we're doing to actually build up teams where we can actually provide safe and quality complex neurosurgical care to Nigerians. Of course, we might ask, okay, you're in private, so I was in private for a very long time before I started in the public hospital. And why did I go to the public hospital? Because I felt, a significant number of Nigerians will not be able to access my care in the private space. So let me try and push that expertise and all that competence I actually got from UK and stuff, actually get it to people in the public sector where it will be significantly cheaper and stuff like that. And touch wood, at least in the last almost 2 years, I've been providing with my colleagues, complex neurosurgical with very good outcomes in Federal Medical Center. Okay, just like an offshoot of what we've been doing here in Citadel Medicals. So, general advice to Nigerians, again, is that please, healthcare is fundamentally important. The 4 key things in Nigeria that we need is specifically healthcare, education, relevant infrastructure, and security. Okay, and so they should all get their PVC and actually look at all the care of people who want to actually, because it's about 5 to 6 months to the election now. And so in terms of governance, healthcare is one of the key things, so they should be getting their PVC and be getting ready to actually vote people. One of the key things I always say in terms of my mantra is that the Nigerian patients are worth it. Okay, one of the reasons I actually left the UK and actually came back to Nigeria is that Nigerian patients are worth it. Okay, when I got to the UK, I found out that these guys don't have the population, they don't have what we have in the ground in Nigeria, but look at the fantastic work they're doing. Look at their philosophy of what we call value for human life, which we don't have in Nigeria. One of the things I always say with Mr. Osho is that values determine progress, okay? Our values in Nigeria are in the dustbin, okay? And that's why leadership is very important, because you can model from leadership, okay? When you model from leadership, people start behaving well. In the UK, when I'm driving, when I get to the T-junction in the UK, the person coming will say, oh no, you go first. In Nigeria, the person coming wants to stay pass. So, but guess what? Culture, when we're talking about culture is dynamic, it can change. We can get to a point where we have the different strata of people in Nigeria across, but vertically, when they start pushing us, understand that, something like healthcare is something that we need to really focus on and put our energies to. Not building coastal highway and stuff like that. We train us on that and stuff like that. So again, it's all about values. And like I always say, Mr. Shaw, the Nigerian patients are worth it. Please put that in your. The Nigerian patients are worth it.
Worth it. Yeah, thank you very much, Dr. Douglas Okor, for talking to us at Prime News 360 for the past 50 minutes. Thank you. People are waiting to read you.
Thank you.
Yes, that's the point. We finished that aspect.
With the audience.